We're going to dive into the 4 major steps of blood clotting. Imagine you're caring for a patient that just had a surgery and you notice a bit of bleeding. Ever wondered how the body naturally responds to stop that bleeding? In this video, we're going to talk about the 4 major steps by which the body controls bleeding. So if you are visiting for the first time, do well to subscribe and hit that notification button so that you always get notifications when there's a new upload. Now you may begin to wonder, why is this blood clotting important? We all know that blood plays a vital role in the body. The blood carries water in form of plasma, it carries nutrients, it carries hormones, it does a lot of things in the body. So a shortage of blood due to bleeding could be very disastrous in the body. That is why the body has a natural mechanism of controlling bleeding, and that is the blood clot formation. So stick around, let's see the 4 major steps of blood clotting. The steps are as follows. We have the first step, which is the vasoconstriction. The second step is the platelet plug formation or the platelet aggregation. And then the third step is the clot formation. And then we have the fourth step, which is the fibrinolysis. So in this video, we are going to dive into these steps one after the other so we can know how they function. Let's pick up the first step, which is the vasoconstriction. As soon as the blood vessel is injured, the body pulls the emergency brake. This is to help stop the bleeding as fast as possible. So a message is sent to the smooth muscles in the blood vessels to make them constrict. And when they constrict, they kind of limit the amount of blood that flows to that region of the body where there is an injured blood vessel. But then this is temporary. The body just does this to buy time to activate other defense mechanisms. And then the body heads over to the second step, which is the platelet plug formation or the platelet aggregation. And this is what happens. When there is a vasoconstriction due to blood loss, the platelets begin to come around that area and form a platelet plug. Now here's what happens. The platelets begin to stick on the injured blood vessel and form a plug. And in the process, these platelets make all other platelets to come to that area and form a plug. Think about you having a broken pipe in your home and then you invite your friends to come assist you fix it. That is what the body does. It invites other platelets to come to the site of injury and form a platelet plug. So when the platelets arrive the scene like emergency responders, they stick to the exposed collagen in the vessel using the sticky helper called the von Willebrand factor. This is one of the clotting factors, and we're going to discuss clotting factors in our next video. So you want to subscribe so that when that video comes out, you're one of the first people to see that video. You don't want to miss out on that video. But then the aggregated platelets are not firm enough to stop the bleeding or to keep the bleeding sites closed for a very long time until when the healing takes place. The platelet plug is just like the whole body without the bones. Let's say the whole body made up of soft cartilage like we have in the ear. If the whole body is made up of cartilages like we have in the ear, it will be very impossible for somebody to stand upright. So that is how it is in the case of a platelet plug. It is not so firm. Because it's not so firm, the body has the third step, which is the clot formation. So let's look into clot formation now. So this clot formation is all about reinforcing the platelet plug with fibrin. In this case, fibrinogen is converted to fibrin, and then the fibrin is kind of stabilizes the platelet plug and makes it firm. And when this happens, it allows healing to take place. This happens through a coagulation cascade, and it consists of the intrinsic pathway and extrinsic pathway. The intrinsic pathway occurs when there is a damage inside the vessel, and then the extrinsic pathway occurs when there is a trauma that is outside the blood vessel. And when the clot is formed, it stops the bleeding. There will be no more bleeding. That injured blood vessel is sealed, so blood will no longer gush out from that area again. But then, after the clot has been formed and the vessels heal, that clot can be a problem to the body because if it is left in the vessel, it can travel in the body as a thrombus and occlude tiny vessels, like vessels in the heart leading to myocardial infarction, also known as heart attack, or it could also travel to the brain and cause a stroke. So that is why the body tries to remove the clot by a process known as fibrinolysis. In this case, when the blood vessel is healed. An enzyme called plasminogen is converted to plasmin. And what this plasmin does is to go and dissolve that fibrin that caused the clot. And when this fibrin is dissolved, the clot is removed so that it doesn't go into the body and cause what we know as thromboembolism. So let's do a recap. The first step of blood clotting, we said that it is the vasoconstriction. Here the blood vessels become narrow to prevent excessive flow of blood to that region. And then the second step is the platelet plug formation. And here a temporary platelet plug is formed. And after that, the main clot forms to stabilize the platelet plug. And after healing has taken place, fibrinolysis happens so that the clot will break down and prevent the clot from traveling in the body. So now think of this process as an emergency team. The first step is that it stops the bleeding, and then after stopping the bleeding, it will patch the leak. After patching the leak, it will cement that place to prevent further leakage from there. And after that, when there is healing, the body cleans it up. That is the fibrinolysis. So with this, you've built a solid foundation in blood clotting process. Do well to subscribe to this channel, like this video, and leave a comment in the comment box. In our next video, we'll talk about clotting factors. So until then, keep learning, keep caring. Bye.